very, very welcome into the first panel discussion of the week called Let's Get Connected. My name is Amy Kelly and I am the Communications and Fundraising Manager with Let's Get Talking. And we're delighted to partner with St. Jarlaths Credit Union and St. Anthony's Credit Union to provide a series of online supports over this week in relation to various topics in relation to supporting our mental health. What we see in Let's Get Talking currently is that 70% of current presentations are in areas such as depression, isolation and anxiety. And I suppose in light of that significant increase in what we're seeing in our service, we wanted to provide some online supports in relation to various topics throughout this week. So today's topic is supporting our mental health and finding ways in which we can do that, and talking to the experts specifically about what they're seeing in relation to mental health especially what they're seeing in relation to mental health. So I'm delighted to introduce our panel for this evening. Our panel is CEO of Let's Get Talking, Cyril Hyland. Thank you for joining us. Dr. Sinead Murphy of Galway Bay Medical Centre. Thank you, Sinead, for joining us as well. And Alan Keaveney of GROW, and a former client of Let's Get Talking as well. He'll be sharing his own journey attending therapy. So thank you all for joining us today. It's great to sit down and talk with experts, I suppose, in very different fields, but I'm sure have very similar advice and that we can all take from today. Cyril, if I could talk to you first, if you could maybe outline what you're seeing in Let's Get Talking currently, and maybe talk to us about the service that Let's Get Talking provides.
Well, I suppose the first thing to say about Let's Get Talking is the whole sort of idea of setting it up in the first place was to reduce barriers to access, basically, in the community. We tried to, if you like, straddle the gap, if you like, or the bridge between public provision and private provision, and a lot of people were falling through the cracks in the middle. I think maybe one of the things that I'd like to address straight away here is the discourse around mental health, because, you know, as we can see from the panel here this evening, there's a lot of people involved in responding to the way people present with mental health problems. And I think in many respects in the past, this idea or the word mental health was almost up in the ether a bit, that, you know, we're in some way not connected to it in the same way as we would be about physical health, for example. You know, and we can see that a more holistic view of health, rather than just dividing it out as mental health, because they're not mutually exclusive. For example, if people who have, say, serious illness issues from brain injuries, accidents, all sorts of stuff, the psychological residual impact of that throughout the life cycle actually proves that, you know, one does affect the other, and likewise high levels of stress and so on. I mean, there's countless studies to say how that can affect the physical health of people. So we've got to get away from the notion that they're entirely separate issues. And I'm glad to be part of a panel that does work in a way that sort of, if you like, meets that challenge. In relation to Let's Get Talking, I mean, in normal times before this plague began, we were seeing in Galway alone, we were seeing over 200 clients a week. Mm-hmm. Obviously, it's presented a lot of challenges for the organisation in terms of lockdowns and so on, like it has indeed right throughout society. In many respects, I suppose, either deliberately or inadvertently, we turned the crisis into somewhat of an opportunity, and that we transitioned to mainly online therapy for people. And we were all very pleasantly surprised by the success of that. Personally, I didn't think it would work as good. Yeah. And I'm not saying that it's the total panacea either, but it's certainly in the situation, it's working quite well.
Yeah. Yeah, like it's fantastic to see, and I think it's really, really important that, you know, it's not the end of therapy, that we have been able to move online, and we're very, very thankful for that. In relation to what we're seeing presenting, can you talk us through what you're seeing presenting, and if you were somebody who would like to attend Let's Get Talking, what would that process look like?
Okay. Well, in terms of making an appointment, we have both a self-referral system which we operate, but indeed, the majority of the people who now attend our service are referred through their GPs, and indeed, you know, the question of primary care and GPs, that's where most people anyway first present
Yeah.
with mental health issues. Anxiety is huge. You know, even the difference with anxiety in this situation is that a lot of the work and theory around anxiety was trying to, if you like, dissolve and break down, you know, irrational thoughts, irrational thinking. But it's not irrational now. It's real. The fear is real for people out there.
Yeah.
So, you know, we have a whole cohort of people now presenting with serious stress issues and anxiety issues, who in normal times mightn't even consider coming forward for any kind of treatment or talk therapy. As I say, in terms of efficacy, talk therapy, it's unusual in this situation. Again, it's a plus. When people present with anxiety, the talk therapy has been shown in countless, in all of the data, most of the data, to be a very effective response to anxiety, like obviously cognitive behavior therapy and so on, like for panic attacks and all that type of anxiety and stress. So the vast majority of people who will be presenting looking for to engage in therapy now, certainly anxiety followed by depression. Other issues as well have become much to the forefront. Indeed, I heard the other day that the legal profession did some research, and they found among their members that there's a 5-fold increase in the number of people making inquiries about separation and divorce, you know. Okay. And of course, the advice there must be that when you're looking at the quality of a relationship through the prism of a pandemic, it's not the best time to be making decisions, I think, about that. But having said that, there are a lot of, and we can talk later about what they are, and I'd be glad to go into that. There are a lot of issues around relationships, and, you know, not just intimate relationships, but, you know, yes, intimate relationships with close family members and so on, because as I say, we can come back to it again, but one of the issues here is we're almost exclusively reliant now for our relational needs with one or two people, and it's a terrible onus to put on one person. We're not scaffolded by loads of other relationships, whether they be at work, social, and so on. And therefore, we're expecting all our needs to be met in the one corner, which of course isn't possible.
Absolutely, yeah, and I think it'd be worth exploring a bit later on. But it's such a huge issue that we're finding, you know, especially if you're in a house perhaps with just your family or just one other person. You know, it's the first person you're saying hello to, it's the last person you're saying goodnight to, it's the person you're talking about the news to, or how you're feeling and everything. So you are right. And Sinead, if I could bring you in to link in what Cyril had said earlier in relation to the GP support. I think a lot of people, anyone that I've spoken to, particularly around accessing supports for mental health, not a lot of people perhaps would realise, when I've been chatting to people, that you can talk to your GP around, I suppose, mental health supports that are available. But yet Cyril is saying so much comes from our GP. Is that what you're seeing in your service?
Absolutely, and thanks for the opportunity tonight, Amy, and thanks for having me on. But I think it's super to be having the conversation. And just want to acknowledge the great work that's been done by Let's Get Talking and by Grow and by so many other organisations out there, because I think, you know, the mental health discussion very much needs to come out of the shadows even more. I mean, good progress has been made, but this is a lot of the problem, I suppose, that we encounter, is that people put off coming to the GP, going to seek talk therapy, often until it has become a crisis. So we'd very much welcome that people would kind of recognise the early signs and when they need to get help at an earlier stage, when it hasn't become a crisis. But we've always been seeing an enormous amount of mental health. Certainly in our practice, we see possibly a good bit more than average just for the younger demographic. So there has been a bit of a pickup in the pandemic in the amount, but I suppose we had vast numbers of mental health problems to begin with. So people mightn't talk openly about it, but we would certainly see that we have a very significant number of people coming to talk to us about mental health problems. Again, as Cyril had said, I would say that most commonly we would see anxiety and a variety of anxiety type disorders, including obviously panic disorders and generalized anxiety, social anxiety. Insomnia, which I suppose is very often linked more with anxiety than depression, but sleep disturbance in general, which is a huge issue. Depression would be a little bit less common than anxiety, but equally very prominent. We see a huge amount of overlap between people who have anxiety and depression, and very often when you dig down into it, you'll see that it started with one side of it and became the other. You know, that if you start off with anxiety and your anxiety is not managed properly, then it will eventually drag down your mood. And we'd often see it the other way around as well, where you might start with low mood and it eventually becomes so troublesome and impacting on your life that you end up with very significant anxiety symptoms and insomnia. And we see other more serious, they're all very serious. What I mean is other more severe anxiety problems as well, which would be more likely to need psychiatry input. But I suppose for the vast majority of anxiety, depression and insomnia problems, we manage them in general practice with obviously the input from the counselling services and sometimes with medication. So I suppose in a lot of cases what we do first is just to do an assessment and figure out a diagnosis for people who just know that they need help, but they're not quite sure what's wrong, or they know that they're one part of the problem, but they need to just kind of get a handle on it. And I suppose we usually encourage people to try and book a longer appointment if they have a significant mental health problem, because it really can't be done as fast as a normal 10 to 15 minute GP consult. So we very much welcome if people have booked a longer one, you know, because it really does take a good bit of delving down into it. So that's one of the main things to do, I suppose, is an assessment and try and figure out. Patient might come into you with one problem saying, I'm not sleeping well, but within 5 or 10 minutes, you realize there's a lot more to it than that. Or they might come in saying they just feel they can't go to work at the moment, but you try to figure out, well, why is that? So I suppose in doing an assessment, then we try to figure out what is the underlying likely diagnosis or problems, and also to kind of grade it a little bit and to reassure the patient that what they have is extremely common, and that we see it a lot and that it's very treatable. And even at that stage, you often see people relaxing a little bit and saying, well, that's great, because I thought what I had, nobody else could ever be feeling this bad. And then you kind of just delve to see what are the added factors to try and figure out how best to manage it. And so once, and obviously, no more than Cyril said, we are doing a lot of this by telemedicine at the moment. So we're doing primarily video consultations to try and keep the volume of people in the premises down, so that when we do need to bring people in, it's a bit safer for everyone. So it's a little bit challenging, but we actually find that the video consult platform suits mental health problems usually quite well. It's not for everybody, so we adapt to that, and there are some people who just don't want to be on video, and we'll do phone consults. It's easier once you know a person to follow up with phone consults, but it's difficult with somebody you've never met before.
Do you have to disclose everything that you know if you do want to attend your GP and talk to them about your mental health? Like what do you have to talk about, or you know, can you just, like you were mentioning there, saying that you might be suffering with some symptoms, but you have to go into detail of anything?
Well, so it varies, you know. I mean, from the first point of, you know, of making contact with the surgery and booking an appointment. Obviously, you can just book an appointment and not say what it's for. But as I say, people who will get more out of it, you might say, look, it's a mental health consult, I might need longer time. But you don't disclose any more of that, other than to say that that's why I might need a longer appointment. And not everybody needs a longer appointment. It's just that if it's a new problem for you and you've never discussed it with the doctor before and it's affecting your life in enormous ways, then you do need more time to try to get to the bottom of it. But as regards how much you open up to the GP, I mean, obviously you need to have a relationship with the GP, but I think, you know, most people will find that their GP has been through all of this before for years, and they're very familiar with every problem you can throw at them. So I would encourage people not to be afraid to say how you're feeling to your GP, And all GPs have done, you know, varying amounts of training in mental health, will be familiar with recognizing the common conditions and how to manage them. So you're likely to get more out of the consult if you can be, I suppose, more open about what's really worrying you and what are the biggest problems that you notice. But the other thing I'd say, with time constraints in general practice, and it's not always possible to get longer appointments, try to get the main issues out in the first 1 or 2 minutes. And you can't usually get a whole load of things dealt with in one appointment.
Yeah.
But at least if you focus on the most important ones, then it's possible to rearrange the next, you know, because there'll be another appointment for follow-on anyway. We would see a huge amount of health anxiety, and I think that's something that has exploded a lot in the pandemic as well. Because people aren't in contact with other people and they don't have the usual supports, a lot of people unfortunately think that you know, general practice isn't available for normal problems and that we're all too busy. I mean, we're not. You say overall we're as busy as we always were, which is usually running behind and very busy all day, but that hasn't changed that much. We've seen a reduction in some problems. We've much less sickness in the under sixes and in people in general, because people aren't in contact with each other. And obviously we're a bit busier with some COVID related problems, but it's nothing like on the scale of the hospitals. So we're very much available, and people should book in, but unfortunately people can be a bit reluctant, and then unfortunately people and look online to see what happens if you've got palpitations or chest pain, and suddenly a relatively straightforward anxiety problem is a heart attack, or a pain in the side is a cancer, and people have often worked themselves into a frenzy by the time they come into us. So they might come in saying, I think I've got this really serious pain, and in fact the anxiety might be the main problem, and it's 10 minutes into a 15-minute consultation before we've figured that out. So obviously it's a case of trying to balance the problems and say, look, we'll deal with this problem now, but I'm concerned about your mental health, and they'll say, yeah, I'm extremely worried in general, but I'm much worse now. So then we kind of arrange a follow-up appointment for that. And I suppose a lot of it is down to, from the point of view of once you've figured out what the main problem is, it's about management. And I find it usually helpful to tell people that there's usually 3 approaches or 3 choices of managing a mental health problem, which would apply for most people. So 1 is the environmental factors, 2 would be talk therapy, and 3 would be medication. And it's not that everybody needs all 3, but that I think it's usually helpful to focus on every individual person who's coming in, which of those 3 are the most important to focus on at this time. And it will be different. I mean, for some people from the environmental point of view, if they absolutely can't cope with work at the moment, a lot of them need a cert for work. And often a 2-week cert for work will allow them the space to try to get on top of the other problems. And obviously you have, you know, the exercise and the sleep routines and the social media side of it, the internet, and meeting friends and opening up to friends. So all of that side of their lifestyle and the environment. The talk therapy is absolutely extremely important for most people. It's not for everybody, but it's really important. Now, some people, when they see us, they might be in a crisis, they might be quite frazzled. The anxiety symptoms and the insomnia would actually stop them from being able to have meaningful therapy immediately. But we might try and manage the crisis and then tell them to book in to have talk therapy booked for when they start feeling a bit better. Medication, so not everybody needs medication, thankfully, and medication would not be appropriate for a lot of problems, but I suppose we find that it is very important for quite a proportion of people. But it's about kind of choosing what is important for the individual person in front of you. And for a lot of people, if insomnia has become the biggest problem and severe anxiety, you need some way of trying to manage that, if it's panic attacks. And so there's a variety of approaches, but sometimes you give somebody a very short-term prescription for a sleeping tablet and a work cert and tell them that we'd like to explore their anxiety 2 weeks later, and they're a different person. But they're now ready to tackle it, you know, and then it's easier. And obviously for some people, they might need medication for depression or anxiety on a longer-term basis. And it's about filtering out who are the people who we feel do need that and who are ready for it, and that they might not do as well without it. Because as we say to people, it's usually the fastest, cheapest, easiest way to get on top of your depression is to go on an antidepressant. And the results that we see back are that about 70–80% of people will do really well with it, but not everybody. So we try to filter out, well, who are the people where that's the first way of dealing with it and not. And, you know, no more than if you had high blood pressure or diabetes or a thyroid problem, you know, I suppose if you get a recommendation for what might be the best types of therapy for you, it's a good idea to follow it regardless of which type of medical condition it is. But, you know, and obviously there's a lot of variation and room for kind of debate in the best ways of managing that. So we can get into that again.
Absolutely. Yeah, that was really, really insightful. Thank you so much.
Can I just make one comment there, please, if I could
absolutely.
just for a second. Well, the policy at Let's Get Talking in relation to, say, for example, medication is, and you know, to be honest about it, there's been a lot of freeze-on and conflict between, you know, over, say, among the talk therapy community and over medication and over prescription. You know, that conversation has been going on for a long time. But I think it's time that we actually put that behind us, because as Sinead said, sometimes medication, some people for various reasons need it. And one of the things that we seek to ensure from a client welfare point of view is that people who are prescribed particular medications and who need them, that we encourage them to carry out the instructions of their doctors and so on, because that can be the difference sometimes between, as Sinead said, getting to a place where they're really able to engage or not. So we would be supportive of that. And in any event, it's not one of the main reasons, if there ever was, you know, and there was, I would imagine, and we all heard about, you know, there was over prescription sometimes, I think it's fair to say that. But one of the reasons for it was that GPs had no other pathways other than to medicate, because there wasn't availability of any kind of therapy, whether it be psychiatric or psychological distress therapy.
Okay. Yeah, like it's such an important point. I think there can be so much stigma and taboo, I suppose, around medication. I think it's really important, the light you've shone on it today, Sinead. So thank you so much for that contribution. Alan, you've been sitting patiently there. Thank you so much. I'd love to link you in here because, yes, as we mentioned at the start, you've joined us today in a two-person capacity and your role in Grow, but also as a former client of Let's Get Talking. And we really do appreciate you being here today to bring, I suppose, the human lived experience of what both Sinead and Cyril are talking about. Based on what's been said so far, do you identify what they've already mentioned?
Well, I do, and I, like you said, I'm kind of wearing two hats. So I'm looking into the Let's Get Talking and the one-to-one therapies, and my feedback and my experience with those, and then my work in a peer support mechanism, which would be Grow. So I won't go into very detailed history, but I'll just give you an idea, because we've mentioned panic attacks, we've mentioned CBT, and I just want to give someone a little physical view into that. Okay, so I've been a service user now for 20 years, and for the first, I would say 2/3 of that, things just didn't go well. It was just chronic, back into hospital, out of hospital, back into hospital. So in those years, it's hard to believe now, but for those 13 or 14 years, it just was hospitals and medication. I didn't really get involved in one-to-one therapies. I didn't get involved in peer support. So I think two things kind of changed then. What brought me into the one-to-one and Let's Get Talking was my reaction and my follow-up to a really, really severe panic attack. It was about 6 years ago. I had just come home from psychiatric hospital. I had been prescribed an extra little medication to calm my mood a little bit. And I remember reading the leaflet, and I still don't know to this day what happened. Was it just reading and letting things get carried away? But I had a severe, severe panic attack, and I was basically rolling around, and I thought I was dying, and my family, it was very scary for them. And this was like 10 or 11 o'clock at night, and what do you do? So we actually had to call an ambulance. So the vast majority of people who deal with anxiety don't get to that scenario, you know, and that was the first time that ever happened to me. But it was very, very scary. I had to go in the ambulance. I had to be on oxygen all the way. And I remember being in this inner sanctum of A&E in Galway, and I remember apologizing to whatever doctor was examining me, saying, I know this is in my head. But to me, it felt very real. And he said that to me too. He said, Alan, you're going through rotten, awful symptoms at the moment, and that's what we're treating, you know. Yeah. So just to get back to the Let's Get Talking, I would have been into hospital for the first time after that, dealing with anxiety, because before that it was only ever my depressive or elated moods. There was a problem. I never really suffered from anxiety before that. And I had a short period in hospital. It was 6 years ago. I think it was 6 nights in, which was very, very short for me. And we did a care plan, which is something they're doing now, which it's a very good idea. And top of the list of my care plan was getting CBT sessions. You know, some people call it yellow pack CBT. It's not a very favorable way of looking at it. But the problem was that was in the public system, and my team had to tell me, Alan, I'm sorry, but you need this therapy, but you're not going to get it in the public system for 12 or 18 months. So I went and got the therapy privately, and I just had 6 sessions. That was it, literally 6 weeks. And that I've never, ever had a similar scenario erupt again, you know? Yeah. So that was one example of a short short one-to-one counseling that solved a problem for me. And I suppose the second time that I would have linked in with you was when I started work with Grow, and I was supervising support groups, and a lot of things come up in support groups. You know, people's abuse comes up, people's suicidal ideation comes up. It can be very difficult, and you're trying to keep a lot of people happy as well. And sometimes people, you know, aren't in the best of health, and they'll be putting quite a lot of pressure on you. So I would have felt that 1 hour a week, I did that for 2 or 3 years, I think, with up till quite recently with Let's Get Talking. And it meant that I could do my work and do my work well. If I didn't take that approach, I think I would have still probably done my job, but I would have been very stressed the other 10 or 20 hours of my week that I would normally be enjoying myself, you know. So that was all the one-to-one. So I suppose the example I'm giving is that for some people, they only need a few sessions. It's not end of the world if you're dealing from anxiety right now with COVID, or you're out from your job and you've never been idle for 3 months or a month even, you know. Yeah. And just to give kind of a brief example of how it can happen, just because you've asked Sinead, who does she see, and Cyril, who do they see? Yeah. We see people that have no history whatsoever of mental health difficulties. And now, because I'll give an example of somebody who was in a barista in a coffee shop, and he was out on COVID for 3 months, I think. And again, he was from South America, so he would have no supports in Ireland. And unfortunately, at the end of the period when he was to go back to work, he was so unwell with anxiety they couldn't link in with his staff. He wasn't able to deal with customers, so he literally could no longer function in his role, you know. Yeah. So I suppose the good news tonight is that they got into this problem very quickly, and I'd like to think they can get out of it hopefully without too much stress, you know. Absolutely. And the second thing that I would point to, besides one-to-one therapy, is the beauty of peer support and the value of peer support. Yeah. So I wouldn't have ever gone to any peer support until about 5 or 6 years ago when I went to Grow. And I think I was aware as well briefly, but I kind of moved towards Grow more quickly. So with Grow, it's a peer support group. It's people with lived experience around the table. There's not a huge number. If we have 5 or 6 on a meeting, we're delighted with ourselves, you know. Yeah. It functions best if you go on and I kind of get onto it in a bit more detail, but just to let you know, like, how do we operate? We've got about 1,000 people that we see across the country every week, and we would also we have leadership routes in Grow, so people can become the evaluation person of the group, then they can become the chairperson of the group. But it all revolves around the peer support and sitting around the table with someone who has been depressed, who has had anxiety, that has had those experiences. So I think I'm getting on a bit long, so I'll let you.
No, not at all. Never say that anyway, because I think everything you said was very valid and very, very important to highlight. And I think, you know, I think what we want to highlight in this conversation is, you know, there's many options available to us in relation to supporting our mental health. There's no one pathway in relation to supporting your mental health. So, you know, in relation, if it's talk therapy, if it's talking to your GP or peer-to-peer, everyone is just as valid, and every option is just valid. So it's finding the right pathway for you. And it's the same going to therapy. Cyril, you'd probably agree that sometimes it can take you a bit of time to find the right therapist for you. It doesn't mean, you know, once you attend your first counselling session. I mean, you know,
Elaine Ryan, the person who is responsible for referrals in our centre in Galway, one of the things that she found was that it's not just about matching the clinical presentation with a particular, a particular skill set of a therapist all the time. Is sometimes it's about just simply a good match with the therapist, because as Sinead said earlier on, the relationship, most good work happens is built on the strength of the therapeutic relationship, and it's obviously the same in the medical practice. One of the other things that came up earlier there that I just wanted to mention, and I think Sinead mentioned it earlier, about one of the problems I think in many respects is, although it's very laudable that, and it's topical, that people are very interested in crisis sort of response, suicidality and so on and so forth. And when people get to a certain stage, basically, I think that early intervention allows us to sort of preclude the need for costly psychiatric interventions that otherwise would happen if they don't get in there in time to deal with these issues. And it is an incremental issue, mental health. It doesn't get any better if you don't do something about it. But furthermore, I also want to give a shout out to people here who don't have a mental deficit as such, in that there's nothing wrong with them as such. But people, if we're talking about wellness, people don't wait to look after their physical health until something, or well, they shouldn't anyway, and they're encouraged not to until there's something really seriously wrong with them. But people also come for therapy for personal growth issues, and they would probably make up the majority of the people who come to Let's Get Talking. And that's really how you address the issue of mental health, because it's, responding, and as I say, it's all well-meaning, but responding to people's needs, and they do need to be responded to when they're in crisis, but it's almost like politically, particularly at that level, people want to be sort of associated with dealing with terrible things, for people. But I do think that the idea, the one strength that talk therapy has, is the ability for people to find meaning in their own lives, and that's often what it's nothing more than that sometimes.
Yeah, and I think what Alan had mentioned there was really interesting, Alan, when you were discussing your personal story there, and when you were saying you were going off in that ambulance and you nearly felt bad or were nearly blaming yourself. We never blame ourselves in relation to our physical health if something goes wrong, but it seems to be if something goes wrong in our minds, we seem to blame ourselves and talk negatively about ourselves. So I think we need to change that language as well. Absolutely. Cyril, you just mentioned as well, just to come back to relationships, you mentioned that earlier, that we're seeing a lot of pressure. Would you like to expand on that a little bit more, of what you're seeing currently in the service?
Well, I suppose the challenges being presented overall in all sorts of relationships are difficult, and it's kind of unprecedented, and it's unnatural times, And you may, as I mentioned as well, you probably you're stuck, if you want of a better word, with maybe 2 or 3 people all of the time, and there's emotions, and stressful situations mean they're difficult, and we can become emotional, we can become frustrated, irritable, and angry. We all can, and while it's not encouraged, say, that people repress emotions, there's the other side of that as well, that people sometimes, we all can sometimes, if you like, convey or communicate emotional experience that inflames situations and causes terrible rows over who broke the good cup, when the elephant in the room is COVID, And I think that one of the things we need to do, this is a social trauma for people, it's totally unnatural. And, one of the things as well, the terrible events, how can I use this in some way as a positive or a benefit for myself? The first thing to say about this, I think the most important thing, and it's front and center in the mission of Let's Get Talking, as well as it so happens, is, we need to focus on the collective response of people here to this problem, It's not just individualistic. And this might put some some perspective on feeling strong emotions. You know, I think it was a 16th century French philosopher called Pascal who said we need to balance emotion with values. And the value here that we need to focus on, I think, is we're trying to save other people's lives and our own lives, you know, and that's what this is all about. So sometimes if we know what the process is and why we're doing something, then we can look to a possible future, you know, when this is all over, and it will be all over. And I think one of the messages that should go out to people tonight is that there is hope, you know, there's hope of a different future when we get to it. And one of the things about trauma, and I'll finish on this, one of the things about trauma and recovery from trauma is being able not so much to ask the big questions about the meaning of life, but rather to focus on the questions that life poses for us. How can we cope? Often, and I have personal experience as well, like Alan, in terms of, you know, personal experiences that we've had that maybe seem traumatic, difficult, or if you like, at least we can, when we go through adversity, I think there's one of the things, and one of the satisfying things is that we can have gratitude for coping with it and being able to get through it. So that we need to have some narrative to get through this on the basis of how is this making me a stronger person, a better person? And the word I'm talking about here, which leads on to hope, is resilience. You know, that's the thing we need to try and foster. And that's by, you know, whether it's online or not. I mean, look, technology, it if you like, it shortens distance between us, but it doesn't foster nearness or closeness. And one of the things we need to do here, I think, is to try, and it's not easy, is to focus on something beautiful, like, you know, going for a coffee with friends or going for a pint again, or whatever it is you like to do. And in the meantime, we can do and try things weekly, for example, that we never did before. We can open ourselves to new experiences. And if we can get meaning from that, I think we can get through it, you know. And I think it will help people, not all of the time, you know, but I would say somewhat maybe, you know, tongue in cheek, you know, maybe we should be somewhat informed by someone like Pascal in that time when we feel like choking the person that we're looking across at, you know.
That was really insightful, Sarah. I think it's really, really important. And like, I think in the very first lockdown, it was such a novel experience to us all. And in some regards, I think we nearly all wanted to break those of us that had to just stay at home and just, you know, that's all we had to do. So it gave us time to catch up on the books and do all those jobs and start the sourdough starter, which I also did. It has long left my life now since the first lockdown, but you know, those things were quite novel and we had the time. So I think even trying to channel in a way that kind of mindset that we had in the very first lockdown and bring that, how can we bring that little bit of joy back into our day during these long days? And you know, it is the third lockdown, but you know, what makes us happy that we can do for ourselves, whether that be reading, getting out into the fresh air, is so important.
I think, Amy, one of the things that we should be encouraging people, those of us that work in this area, is to avoid a lot of the crap, if you like, for want of a better word, on the internet, you know. And in relation to COVID and everything else, conspiracy theories, anti-vaxxers. I mean, if you were to listen to these people, some of them, you wouldn't get out of bed at all, like. And the one light at the end of the tunnel at the moment is, there is a light at the end of the tunnel. You know, in a few months, the vast majority of the population are going to be vaccinated. You know, and there is a way out of this. And we need to trust on in the potentiality of and the joy of all that as well. You know, someone said to me, I heard somebody on the radio who was suffering from latter stage cancer. And he was asked in the interview, you know, what would he focus on when he'd really feel down? And he said he would focus on his grandson and his granddaughter because they represented something beautiful to him. You know?
Yeah, like it's incredibly
it's not
important.
So much what happens. And the other final point is the question about, you know, reacting to situations. We can't control what goes on around us, but we can, to some degree, control how we respond to it. And the key is response rather than reacting, you know, to be somewhat a little bit more measured and understand as well that what we're going through and what's peeing us off is also really annoying the other person as well, and being somewhat trying to practice. It's not easy all the time, mind you, to be somewhat empathic.
Yeah, I think, trying to just step back from a situation is just really, really important. Sinead, if I could bring you in, I think Cyril kind of spoke about ways in which we could support our mental health, but looking at other ways that we could support our mental health, we have topics coming up later in the week in relation to diet and to exercise, some exercise classes and yoga classes, and a talk around the importance of looking after our diet. But can you talk to us about that, and as well the importance, I think you'd mentioned it earlier as well, the importance of sleep and a routine. I think, like, I remember for the very first lockdown, sleep was like my main focus, that I was like, because usually at Christmas time, I don't know if anybody else is the same, your routine, it's the only time of the year for me personally, my routine flies out of the wall. I'm up till all hours, I'm sleeping all day, and it was one thing I was really cautious of in the very first lockdown, that, you know, to try and have some normality. Could you shed a light on maybe some tips or what you see in relation to sleep and the effects it has on our mental health?
Sure, and I think, you know, just as you mentioned, like your lifestyle and what you're doing every day and the routines are a huge amount towards how you can foster resilience, and how some people are doing much better than others. I mean, I think when we go back to the first lockdown, I would have to say that when the whole thing happened and erupted, I kind of nearly saw it as a good thing. I said the world needed to slow down, because after years of seeing people just stuck on this hamster wheel and on a roller coaster, people would describe kind of how they're feeling, and just that they felt stuck, that they were constantly on the go, couldn't catch up with themselves, no time for anything. You know, and that I think for an awful lot of people, they just needed to slow down. And okay, it was somewhat forced, but for a lot of people, it has had a lot of positives. And I think we've seen different cohorts even in this pandemic than before, where a lot of people would have surprised me by having struggled so much last year and the year before, maybe rather, with mental health problems, that they were doing so much better in lockdown. They now didn't have to go into work where they were kind of being bullied, or they were kind of having adverse experiences a lot of the time, and they just felt they were constantly commuting, and everything was, you know, just a lot of too much stress. So a lot of people are doing better in the lockdown. A lot of people who unfortunately find themselves out of work at the moment have kind of taken it as an opportunity and have decided to put more routine on their time off, to make sure that they're getting out for exercise at least once a day, and sometimes twice. And the diet of trying to kind of eat healthy, trying to kind of prepare food themselves, where they were relying on a lot of fast food or kind of convenience options when they were too busy. People just taking more interest in themselves. I think alcohol, you know, has been a big topic, and we haven't really discussed it, but in the first lockdown, possibly even the second one, a lot of people, I think, turn to alcohol as being kind of, how do you cope when something is turned upside down and drinking too much. And we've certainly seen a lot more people who have that under control now, who have recognized that, having let it go, that they can't let that continue. So I think getting that under control as well is really important. A lot of people use alcohol as a medication because it's available when they're feeling very stressed, be it either from depression, from anxiety, from suicidal thoughts, from panic, that they can turn to alcohol, which obviously, as we know, for a lot of people is just going to have the opposite effect. Alcohol is generally, you know, a mood enhancer. If you're not in a good place to begin with, it's much more likely to make you worse than better, but you can temporarily feel it makes you better. So I think it's important to recognize, if you have an alcohol problem and you're taking more than the recommended amount per week, or you're not able to go a few days without alcohol, then you need to get that sorted. And sometimes that requires help through the GP, but a lot of people can do that themselves. That's very important. I think getting the work situation and the work-life balance under control is another important one, which people are trying to do. I would certainly see the internet and social media platforms and the eruption of them as an enormous factor, and I think it ties into the sleep problem. I think it has become, unfortunately, normal in recent years for people to spend their lives on their phone, and, you know, kind of totally missing what's going on around them because they're so busy catching up with what's happening on each of the social media platforms. And for a lot of people, it just brings out a vulnerability where they feel inadequate because look at all these things that other people are doing on the internet, and I'm not doing that, and I'm not good enough, and my friend did that, so we see a lot of it, and I'm sure you do too. And there's plenty of evidence out there that the more social media platforms you use, like if you use 5 or more, you have a 25% increased chance of anxiety and depression. So I think they should come with a health warning, and people should stand back and acknowledge it. And if you try to do even one day without by turning off your social media platforms, just see how it affects you. So I think thankfully this time around we see a lot of people who recognize that they're kind of going down the rabbit hole and that it's just getting them deeper and deeper into a feeling of satisfaction. That we're just trying to get rid of any of them that aren't helpful. I think you have to say, is it nourishing you? Is it helping you? Or is it contributing to your stresses? And I think, you know, the internet platforms or the kind of chat functions which you genuinely find help you to stay having a laugh with your friends should definitely stay.
Yeah.
I think the ones that just cause you stress and feel that you're addicted to them and you must kind of compulsively keep checking your phone. You know, how often do you pick up your phone to see what has happened? So I think that's an enormous thing, and I think in the future that will probably be challenged on a bigger level. But at the moment, there's so many companies making so much money out of making you stay 1 second longer on your news feed that there isn't enough of a drive to stop that happening. So I think that's a huge thing. I just wanted to touch back as well on.
Yeah, go on.
Yeah, that's fine. I think we could have a whole other day on that, but
I know, it's a very interesting topic.
Earlier, that were mentioned. The one was the suicide, and not to dwell on it because again that's a whole other topic by itself. But I suppose it's something that a lot of people are, and thankfully there has been a lot more awareness of it. And if you have any concerns yourself, or you know anybody who you feel might be having concerns, it's really important to get a conversation going about it and address it. I think there's a lot of stigma as well. Still, people think, oh, you mustn't mention suicide or ask anybody are they feeling suicidal because maybe that'll put the idea in their head. And that's by and large not true. I think it's really important to give people a safe opportunity to talk about it. So we do it a lot, obviously, in a mental health consultation, of finding out where people are at. And trying to normalize it, as we see an enormous amount of people who are somewhere on the spectrum of having thought about suicide. And I suppose in a lot of cases, what we will word it is it like a passive death wish? In other words, do you sometimes get up in the day and wish you were knocked over by a bus because you wouldn't have to keep feeling how bad you feel? And people will usually relate to that and say, yeah, I wouldn't do anything, but that's how I feel. Yeah. You know, and I think even when people manage to get that off their chest, get the conversation going, and that's really important. But, you know, when people have had suicidal thoughts, it's important that we can kind of in a safe environment be able to talk to them about it and say, well, do you want to tell me a little bit about what you've thought about and how much it worries you that you might kind of act on an impulse? And I suppose alcohol is a really important part of that conversation, because we would see that as one of the, unfortunately, the biggest worries and concerns is somebody who might be a bit vulnerable for suicidal thoughts, that alcohol will sometimes give, you know, Dutch courage that they didn't mean to. And you know, I think just looking out for friends who you feel might be in that situation. The other thing, as Alan said, just wanted to pick up on the panic attacks and panic disorder. And it's extremely common, this situation that Alan described, where somebody starts having a anxiety that builds up and becomes overwhelming into a panic attack, that it absolutely feels like they might be having a heart attack. They've got a lot of the same symptoms. So what do you do then? Well, you go to the internet and you Google your symptoms. And a lot of people do this and find, oh yeah, the internet will confirm that if you have these symptoms, you're probably having a heart attack and that you might die. And it's extremely real, frightening feeling for somebody to have. And then that they're totally out of control, because there might be a rational part of your brain saying, no, I'm too young to have a heart attack, which is true usually for a lot of people. But the physical symptoms are too overwhelming. So I think that's just a really common scenario. And I suppose what we want is to avoid kind of repeat scenarios. And unfortunately, some people do end up having this repeatedly before they do get the help they need. And CBT can be an enormous help, and we try to encourage people to get that, and lots of other therapies which will be very helpful for panic. And I suppose one of the therapies which can be a really useful add-on to their armoury would be having a relaxer tablet in their possession. so that if they ever find themselves building up to that crescendo again, that they know they have something that can stop it. And what we see, and it's lovely to see it coming back, is people who've said, I'm not having the panic attacks anymore because I know I've got the tablet. Haven't actually needed to use the tablet except for that first time when you gave it to me, and the next panic attack I had, I took it. And for all the other panic attacks, they actually never got to that level because I had something that could fix it. So we need to be extremely careful about those kind of tablets. Obviously, we don't want people getting hooked on them, but that's why, you know, but it's very much an important part of kind of having a management plan, is that you have a get out option that doesn't hopefully involve an ambulance on a repeated occasion, you know. But so that's sometimes a help until they can get into the talk therapy that they need, and to the CBT, and to the kind of recognizing the triggers and how to manage it. So anyway, they were just things I wanted to.
No, they were very valuable. Yeah, Alan, I'd like to bring you in here. We will be finishing up shortly. So thank you everyone for being with us. But Alan, I wanted to give you the final word, I suppose. Because
I thought I'd have more time, but I'm just going to give people 7 different other supports that they might never have heard from. And I kind of predicted we wouldn't have enough time, so that's why I sent in the web links for all of them. Okay. So I'll just go through them in 60 seconds. Okay, so there's a new Galway Recovery College based in Jarlaths there in UIG. They do modules on recovery, trauma, self-care, that type of stuff. There's Employability, who help clients with mental health difficulties get back to work and sort out their social welfare. I've used them, they're brilliant. Claddagh Watch do physical prevention work on the water. There's the Community Cafe in Galway, which is in Mr. Waffle. That's Kevin Nugent's business. He gave them the building. So there's 4 peer connectors there: Thursday, Friday, Saturday, Sunday nights. CUSON are a Galway-based peer support charity in Galway. The link is there. And the final 2 are HSE-based. There's a peer support worker, which is somebody with lived experience who's now on a multidisciplinary team and can help with clients. And the last one is, if you want to improve the services, and we all need to improve the services, there is a mental health engagement officer now in the HSE, and they've set up forums in different cities, and you can have your say and improve the services. So go to the links is the best thing I would say.
Yeah,
is that okay?
Absolutely. No, absolutely, Alan. And I think it's really important, you know, I think what we want to highlight this week in particular as well, and Let's Get Connected, you know, there's so much support available around Galway, and I suppose obviously around the country, but, you know, there are people there that if you need to talk to anybody, there's various ways in which you can do that, and there's various organizations as well. Alan, to give you the final word, because I know you were kind enough to give your lived experience, for anybody who's listening in today, who's heard the advice from the experts, and obviously what you've outlined of your personal story, thinking back to the time that you would have perhaps accessed Let's Get Talking, our services, what advice or what message would you love to get across to somebody who might be still a little bit unsure or a bit nervous, or, you know, taking that step forward? It is a big thing to happen in your life. What would you say to them?
My advice is quite simple. It's to try everything and do everything. Don't just rely on medication on its own, like I did for years, waiting for that to improve. Don't even maybe rely on a one-to-one counselor just for an hour. Try peer support, do the exercise, diet. It literally is sleep. Every single one that you do is reducing the difficulty of recovery. That's what I would say. Yeah. So every single, sounds very simple, but it actually, that's what in my experience. And I would have got some more years back if I could have learned that younger, maybe.
Well, no, Alan, thank you so much for sharing that, and thank you to our Cyril.
Just one thing, I'd like to back up what Alan says there, just because there's not one answer here. You know, it's a collaborative approach from everybody, and as you know, talking as a service provider, we need to value the service provided by other providers as well. Obviously, fantastic care is important in primary care, but all of those organizations have a contribution to make. Yeah, that's all.
Absolutely. Well, no, thank you so much for everyone being with us. I'm just going to share something on the screen here just for everyone, based on the conversation that we've had today. I think it's really important to highlight some numbers in case you who are listening in would like to talk to anybody. There are some 24/7 calls, helplines, available to you. And again, if you'd like to book an appointment with Let's Get Talking, our details are on the screen there. But do talk. There are supports available. There are many of us out there who are very willing willing to talk and work with you to I suppose get you back to the space that you want to be in, or whether that be personal development or just dealing with the anxiety of the pandemic. Of course, there's supports there for you. So please stay with us throughout the rest of the week. Our next panel discussion is at 12 o'clock tomorrow, and that is on youth mental health. We have Grace Harrison, who's a psychotherapist with Let's Get Talking, and we also have the welfare officer of the Irish Second Level Students Union, Matthew Ryan, joining us in that conversation. And then we're looking at 7 o'clock tomorrow evening on the topic of isolation and loneliness in a bit more detail there. So please do join in there. And then on Wednesday, we are looking at yoga at 10 o'clock in the morning and an exercise class at 1 o'clock. And on Thursday, we are specifically looking at diet and the role it plays in relation to looking after our mental health. And Friday's topic is working from home as well. So we'll be sharing some tips in relation to creating boundaries in that. So thank you so much to everybody who stayed with us in this conversation. I found it very, very insightful and very empowering. So thank you as well to our panelists for your information and the advice that you gave. It was absolutely fantastic.
Thanks, Amy.
Thank you.